Budget Committee meeting in the Capitol this session. There's going to be a field trip off the farm next Tuesday, the 18th. We're going to tour the 988 call center. And Francie has reminded me that we need to get attendance. Who's going to be able to make that? It's going to be around, I think, 12:30. Is that right? Lunch will be available there. And were there any kind of dietary things we need to do, Francie? Or just get a head count? Okay. So yeah, we need a head count if you're going to make the 988 call center, the tour next. It's next Tuesday, the 18th. Yeah. So I'm trying to read the tea leaves on what the schedule will be on the session floor, but I'm hopeful that we'll be ready to, on that particular day, at least be able to do whatever duties we have on the floor and then be able to go do this. There will be no other committee conflicts. So an opportunity for us to go visit with Monica, I'm sorry.
Does she want to know, can I do a tentative?
Sure. Yep. Yeah, and that's fine. Just if you're available and you're going to go, or if you're available and can go, if you can give that information to Francie, and it's easier to back off numbers than it is to probably add. So, okay. So so there will be somewhat of a non-disclosure type thing, I think, but we can do that once we get there. So, go ahead, Brent. Oh. The boss has given me advice here. 1 second, please. No, it's oh, okay. No, Francie's correct. So when we get there, they will have us sign the confidentiality agreement upon arrival. So and once we get the numbers, we've got the address and any of the other details that Francie's been coordinating this, and I thank her very much for that. Okay.
What's the time frame on this?
It's start roughly at 12:30 around lunchtime, and then it's about an hour-ish, hour and a half maybe. So if you think back to the when we were hearing, had budget hearings and recommendations, those kind of things, we did hear from the 988 call center, so an opportunity to kind of see them in action. Okay, so today, the topic is contract healthcare regulations. We have Scott Bruner, the Deputy Secretary of KDAS. We have Kylie Childs here from Leading Age Kansas, and Linda Mowbray from the Kansas Healthcare Association. I think Scott is going to lead us off. So, Mr. Secretary, welcome to committee, or welcome back, I would say, and kick it off for us, please.
Thank you, Mr. Chairman. Scott Bruner, I'm the Deputy Secretary at KDADS for Hospitals and Facilities. I'm not talking to you today in my hospital capacity with the state hospitals, but my other role over our licensing and regulatory functions. And I'll just take a couple minutes to let you know what we've been working on this topic that you're discussing today. So, in indicating I knew how to do this. There's a little light. Oh, there it is. Okay, too far. So over the last couple of sessions, at least back to 2020, there have been bills introduced to try to address supplemental staffing, so primarily agencies that provide either nurses or certified nurse aides or certified medication aides to long-term care facilities and other kinds of healthcare settings. KDADS has been sometimes involved in those bills or named in those bills as the regulatory agency, not exclusively, but so we listed out some of the bills that have come through the session or the process over the last couple of years. There have been hearings and other testimony that's been heard over time. Last year, in 2024, there was the budget bill had a proviso that took some of that language from these various bills over time and directed KDADS to come up with a registration process for supplemental healthcare service agencies that required them to register with KDADS, to pay a fee, provide reports to us, and then and with some specificity around what those reports would look like. That bill, that proviso was amended to add not just agencies that provide where a nursing facility might call an agency and say, I need 4 RNs and 5 CNAs, and the agency provides those 9 staff members. There are also some entities that are more like online connection platforms that say, we keep a list of registered nurses and CNAs and connect those with people who need those particular skill sets. So those online platforms were included in the proviso as well. And that went into effect last year. And we did include in the testimony just what the proviso language, if you're needing to, I guess, brush up on reading bill language or want to get ready for next week, you can do that. But I'll kind of cut to the chase of we took that charge and started to think about, well, how would we actually implement that proviso in a way that fulfilled what the legislative direction was and use the authority that we had. So we came up with a list, working with the trade associations and our stakeholder groups. We tried to figure out, well, these are staffing agencies don't have a registration process now, so who are they and how do we find them? So we went through a process of talking to stakeholders and the trade associations about can facilities tell us who they're working with now as a place to start and sort of validate that list. The state of Kansas also had a list of staffing agencies. So maybe this is the one point where I'll talk about my role over the state hospitals, where we use contract labor and we use the state contract for those services. So that at this time, there were about 80 different vendors on the state contract list that provided supplemental nursing staffing. So we put all those on the list. Did some Google searching and talked to the Board of Nursing as well if they knew of folks. But so put that together, came up with a list of 205 different companies. We also had to figure out if there were companies, parent companies, subsidiary companies, who we were going to contact, how many of those we needed to license, but ended up with 205. And so in the last week of June, in anticipation of this starting on July 1, we sent out a notification to those agencies saying, this proviso's in law, we are responsible for registering, and you're responsible for reporting. Please send us a check if you'd like to register and how to do that. In July, we published something in the Sunflower Connection, which is our online newsletter and a paper newsletter that goes out to facilities. We've met with stakeholders as well. And so October 1st was our first round of reporting, and then the proviso requires quarterly reporting from these agencies, and so we've had a couple of quarters of that experience. Again, kind of get to the peanut of it all. So in the second quarter, maybe just one other comment for a preface. So we have no regulatory authority to penalize anybody who doesn't report to us. We don't have a way of knowing somebody who should be reporting but is not. So it is all voluntary. We have been trying to share the list of people who are reporting to us or telling us that they're on the list or are registered, sharing that with stakeholders as well so they can tell us, we work with this company, it's not on your list, did you contact them, and verifying some of those things. But we don't have a lot of authority under the proviso to penalize anybody for not reporting. So in the second quarter, here's what we've had. There were 120 total staffing agencies that are registered with KDADS. 52 of them didn't report any information. That may mean that they chose not to report, or they didn't have people working in the state, or they just didn't report, so we don't know what their status was. There were 55 agencies that reported that they had their employees or nursing positions placed in facilities that operate in Kansas. So those have some level of staffing that's available in Kansas. And 13 of them are registered with us, but reported they don't place anybody in the state. So again, they're not responsible for telling us anything because they didn't have anybody who worked in Kansas. The primary thing that people are reporting is the amount that the company charges the facility to have the supplemental staff person on board, and what the agency pays that staff person to work that shift or that agency. So on the chart that's there on the slide, for registered nurses, RNs, the average rate that the 55 agencies that reported pay or charge is $80.64 an hour. And they pay registered nurses $43.26 an hour, again, on average over those 55. And then of the categories of employees that we're gathering information, licensed practical nurses, You can see the differential there. For certified nurse aides and certified medication aides, it's a little bit closer, but it's in the vicinity of $37 is charged, and they're paying the staff between $23 and $26 an hour. We'll continue to collect information like this from agencies over the next 2 quarters. The proviso gets us through the end of this fiscal year, and then you can make a decision if you want to continue that in the budget process, but because it's in the budget bill, it only has effect for the 1 fiscal year that it applies to. So that's what we've been doing. We do think this is information that's helpful, at least answers some of the questions that the committees have asked and the legislature has asked about what's charged, what the staffing get paid. We can also provide the numbers of people, but the kind of average wages is the primary indicator that we're reporting. And with that, I'm happy to answer questions at the appropriate time, and I'll stay throughout just in case something comes up later on as well.
Thank you so much. Representative Orpeza.
Thank you, Mr. Chair. So my question is there any state that actually has mandatory reporting?
I believe there are. You may hear that from some of the other conferees, that there are some states that have in statute more reporting categories like this that have a little more enforcement authority as well.
Okay, thank you.
Representative Rivas.
Yeah, on your, that last chart now, so this is what their average charge is, what they pay the provider. Could we also add a bar on this for what we're paying, what our average pay is as a state employee for these different positions? Or is that?
We certainly could for the state hospitals, at least. We'd have that.
See what that comparison.
Oh, sure.
Yeah.
I just will tell you for registered nurses, well, our starting pay is about $38 an hour, and with some bonuses, it goes up to closer to 40. Our average is around 55 or so. But let me put the average on here as opposed to starting, because I think that might be more. Yeah.
Of course, one thing it doesn't take into account is I have friends that do the traveling nurse thing. They get a lot of free travel. They get free hotels. I mean,
Sure.
So they're getting a lot of. It's part of them do it as a way to tour the country, more or less. But just as a side.
This is just wages that are, or the charge to the facility, and then the wages that are paid is the way we phrase the question.
Okay, Representative Orpeza again.
Thank you, Mr. Chair. I appreciate your question, Representative Rivas. My additional question would be, is there reporting of if they offer any benefits to these contract nurses?
Don't recall that we were asking, but that would certainly be easy enough to add if it's within the scope of the proviso language, which would be a little bit beyond what's in the proviso, but we could certainly ask. It'd be voluntary whether they report that or not.
Okay, thank you. And my thought process is that, at least when I did agency nursing, there's no benefits. That's why you got a little bit higher pay. So that was just kind of a clarifying point. Thank you.
Representative Ballard.
Thank you. I'm trying to think, the question that Representative Opeza was just asking. I remember, oh man, maybe 4 or 5 years ago, I had my intern call around and find out. And in some places for contract nursing, even when they flew out of state, they provided like temporary housing.
Mm-hmm.
Like in other words, if they were coming for 3 months or whatever, they had housing provided for them and everything else, because it would be difficult to do that. And so that was part of their incentive, that was provided, but it wasn't, but it was outside of the pay. You know, in other words, this was just an automatic provided. So I don't know if they counted that as how much they were making, or, you know.
I believe what we asked for were the rate that was charged to the facility and the pay rate to the staff member, the RN, LPN. So without any of those benefits included, I can check what we asked. But I think, again, to get to what we thought were apples to apple comparisons, the wage, kind of Representative Reeves's question, you know, what we pay a nurse is the hourly rate. We were trying to get the apples to apples comparison for agencies that would report across all 200 that we asked. So we didn't have to go back and check a bunch of times, because we're doing this as a proviso and trying to meet the intent. But we're not investing a lot of staff time in it other than the initial contact and asking people to report.
Thank you very much. Thank you, Mr. Chairman.
Okay, committee, any other questions? I've got two real quick ones. So when you go back to the, I'm going to call it the sample size. Roughly, we think there was 205 different companies or 80 different vendors. And then if I go back to either the numbers of agencies not reporting, those who did report, that 120 number, are you, even if it's a gut feel, are you relatively comfortable we've got a large enough of a sampling across the state to make any decisions based on the data? And I guess where I'm going at, knowing that you've got this sample size, the number of agencies that registered, that created this pay data, if you put your other state hospital hat on, can you make any decisions about staffing or operating at the state hospital or in any other capacity, I guess? I'm trying to make a connection between the data that we've collected and I guess the relevance of it, and can we apply those learnings anywhere, if that makes sense?
I think so. So I haven't looked at the mean or median around any of these averages. We're showing you the total amount paid divided by the total number of agencies reported. There may be a spread, I'm not sure, but we can certainly do that. And I don't know that I feel like the sample is probably large enough to represent the state, but I don't know that we could get into geographic elements of Johnson County, KC Metro versus Sedgwick County. But I honestly haven't looked at it, but we could see if where that's been. The one struggle with any kind of geographic sample would be some of these are companies that are based in maybe one part of the state, but they're providing nurses in another part of the state. Just a complexity, but just to put that on the table. I would say, just from looking at the numbers, I know what, at Larned in particular, the hourly rate that we will pay an agency is $90 an hour. That's the maximum that we're willing to pay. So there are agencies that charge more than that. If somebody would charge less than that and can supply nurses, we'll involve them too. But 90 is our cap. So to me, this says, well, we're kind of in the right ballpark of getting what the industry standard is, or at least what the average is. And in terms of the pay rates for our nursing, in terms of starting pay, we're competitive here. Again, you have to plug in benefits and bonuses and things like that as well. But at least in terms of the staffing that we use, I think this is a pretty representative picture of the pool that we're drawing from for contract staffing. We don't use CNAs. We do use some CNAs. We don't use any CMAs, but in terms of the other categories, I'd say it's representative of what we're seeing.
All right. Thank you. Oh, Representative Carpenter.
Thank you, Mr. Chair. Scott. So do we use multiple agencies, or do you somehow do you contract with the same agency, or is there nurses that are contracted with a different agency in Larned, or do you contract with the same agency for that?
We use, the last time I looked at the report last week, there's 5 agencies that we use, and one of them predominates that list, but we do have contract labor from 5 different companies. Osawatomie have a smaller, they might use 4 companies. But what we do draw from multiple companies on each campus, but there's one that is the vast majority of the staffing.
And I would think that they would be pretty competitive between the different agencies, pretty much the same.
Once we said we're not going to pay more than $90 an hour, there was a lot of competition to get to $90 an hour.
Okay, very good.
I'm sorry, I shouldn't say a lot. Of the 3 or 4 that were willing to negotiate, they got to $90 an hour.
Okay.
And so I think we did indicate, I'm not an economist, but we signaled our price discretion, and so that did have an impact on a couple of the choices that some companies made.
Very good, thank you.
If there's no other questions for Dr. Bruner, let's, I think Linda Mowbray, Kansas Healthcare Association is up next. Linda, welcome back to committee.
Red light means on. Thank you. I am Linda Mowbray, Kansas Healthcare Association, Kansas Center for Assisted Living, and appreciate the opportunity to come here today to talk about the staffing agencies. And we'll be doing this together, Kansas Healthcare Association and my colleague from Leading Age Kansas, Kylie Child. So we'll kind of tag team on this presentation a little bit and try to give you some information from the nursing home and assisted living side of the world, and also a little comparison with the states, some of the states around us, and some best practices, if you will, in other areas. So today we're going to talk about a couple of different things. First, we're going to talk to you about the requirements that a nursing home and assisted living have towards their staff, the types of rules they have to follow, the type of training they have to follow. We're also going to talk about background checks that the facility has to perform on employees and the difference between a nursing homes and an assisted living when it comes to those background checks. Thank you. We're also going to just do an overview, a high-level overview of staffing agencies in healthcare, recognizing that you know, I would say necessary evil, but the honesty is we do need those staffing agencies. They help us to fill in the gaps so we can take care of our vulnerable seniors. But we will talk about the variations across the different states. And of course, the purpose of this is to really look at the proviso language, if we have recommendations going forward, how we can make this better, and comparing what Kansas is currently doing and what we might do better in the future. So that's what we're set out to do today. So the requirements for nursing home. Where am I pointing? Requirements for a nursing home. The nursing homes have to be registered with the state of Kansas through KDADS. They're paying their licensing fees, their registration fees. They're also part of Medicare and Medicaid, at least on the nursing home side. So there's a myriad of rules and regulations and registrations that they have to follow to be a federally licensed facility. One of the components of the nursing home side is that they have cost report. That is part of how their rate is determined for their Medicaid residents that they have. One piece of that cost report is direct health care workers. So some of the money that is paid out for contract staff does get captured in that cost report, but not all of it. There are caps on how much facilities can claim. You can spend as much as you want, but in the direct care, indirect care, you know, the personal property, real property and all that, there are caps as to what the state will look at to reimburse. So that does make some limits on that. We have to comply to surveys. And KDADS is primarily responsible for surveys. When we're looking at a nursing home, they have both federal and state regulations that they have to follow. And the KDADS surveyors follow those rules and regulations. And part of that, as we're coming around to all this, is that they're looking for some specific things with our staffing. They're looking for our pre-employment screenings, if you will, the background checks that we do. Are we checking the register? Are we checking to make sure that they are licensed as they say they are? And is their license in good standing? There's a whole host of prohibited offenses, and it's up to the facility to be familiar with what those prohibited offenses are, but it's also the responsibility of KDADs to keep that register updated if somebody, has committed one of those offenses. For the nurse or the assisted livings that participate in the Home and Community-Based Services Program, HCBS, they have additional requirements that they have to fulfill for background checks. They have to do every 2 years. They have to submit their requests through KDADs, through Health Occupations Credentialing. They do have to check the nurse aid registry. They have to submit a driver's license request to KDOR if the employee is going to be involved in any transportation. They also have to check for abuse, neglect, exploitation through DCF. And that one kind of throws people. They also have to check for child A&E through DCF. And then they have to check to make sure if they have any licenses that they are checking with their credentialing board that they are active. So as you can see, lots of different regulations, including looking at the Office of Inspector General's excluded entities list, and looking at keeping records of all the background checks. So, once you have this done, you have to verify that you've done your due diligence, you have your copies of your report, and you are keeping it on file for that individual. So, the licensing for verification for our staff, it's a lengthy process. It's time-consuming. There are some costs involved with it, but it's very, very necessary so that we are assured our people are who they say they are, and that, they have not committed atrocities in other places. They just can't go down the road and pick up where they left off if they've been convicted of one of these offenses. If we don't do what is set out to do, and the surveyors find that we've missed a background check or we didn't get it done in a timely manner, there are fines. There's fees associated with noncompliance. There's penalties and repercussions that the facility has to own and fix those right away. And deficiencies are more than just, no, you didn't do this right. If it's an egregious enough deficiency, it can affect your reimbursement, your surveys, your star rating. The stakes are very high, not only for the well-being of the resident, but for the business aspect of the facility. It behooves them to do this correctly, and so they do put a lot of time and energy into it. And that's one of the issues that, as we go further on down the road, we want to talk about. If you're coming into my facility, I've contracted with an agency, and they are providing us staff, where are the records of that background check? Does the employee bring it in the door with them every time? Does it get electronically transmitted over to the facility? Is it held until requested in case there would be an incident along the way? There's just some logistics that each staffing agency have the ability to do it differently. And that brings us to some training requirements. And I won't go into a great deal of detail with the training requirements, but, we are obligated to train our staff to do what's right for our residents. Residents' rights, how to prevent abuse, neglect, exploitation, fire safety, disaster drills, things along that line. They're very, very essential parts of being an employee in an adult care home. Questioning a staffing agency, are you doing that training? Where's the proof that you're doing that training? If you're expecting the facility to do that training, what's the catalyst? And are you going to charge me $80 an hour for an RN for me to train that person on our facility? So there's lots of things to consider along that line because, the training, it has to be there. And that's where we can get into some issues pretty quickly. Also with our homes, if an unfortunate event happens, there's an injury of unknown origin or a fall that wasn't witnessed, the home has a responsibility to do a deep investigation as to find out root cause of what happened, who saw it, how do we make sure it doesn't happen again. If a contract staffing agency person is involved, there's nothing to compel the agency to have that staff member appear and answer part of that investigation. And if they're the focus of the investigation, if there's actually an allegation that maybe they were involved and did something wrong, we may never find that person again. We don't have their personnel records. We don't have their home address. We don't pay them. We go through the agency. So there's some gaps in our safety net, if you will, for our folks that I think it's worth our time to look at how to close those gaps. Because if something happens, somebody needs to be held accountable for it. And, mistakes do happen. Let's get some retraining and make sure that it doesn't happen again. But if this is repeated behavior, how would we know? Who would know? And that's where we need the accountability with the staffing agencies. So there's two different kinds of staffing agencies. We have the W-2 workers and we have the 1099s. Right now, the proviso language treats them both the same. And they're very distinct, different animals. Consider the W-2 staffing agency to be more like how a nursing home or assisted living would operate. That's their staff. We have our staff. We pay our staff. We take taxes out of the paycheck for our staff. We have insurance, liability coverage and whatnot for our staff. That's going to be the same kind of analogy for the W-2 staffing agency. The employee works for the agency withholds the taxes. The agency withholds the taxes. They may receive benefits. They may be eligible for health insurance, retirement plans, and paid time off, depending on their tenure with the facility and what their position is. The agency handles the schedule. And they also are to handle the credentialing and follow compliance for nursing. The work assignments, technically the agency has more control over those assignments. Again, verifying the licenses and making sure that they can perform the tasks that they're going to be asked to do. The 1099 companies, the individuals that work for them, they are independent contractors, and they receive a 1099 tax form. The platform company agency is not withholding taxes, not withholding Social Security, not providing that safety net that a W-2 worker has. When the pandemic first started and the rush to work for staffing agencies was really crazy, and people thought they could make a whole lot of money, and they did. And then they tried to file their taxes the next year and found out they owed a whole lot of money. And part of that was simply not being aware of the 1099 situation. So they're responsible for their own self-employment tax, income tax. There are no benefits. So As a W-2 worker, you may be eligible for health insurance through your employer. You may choose not to take it because of the cost of the premium and go out on the exchange and find something that works better. But at least you have an option of going through your employer. With 1099s, they don't have that option, and there's no paid leave. The way a platform worker works is more like, kind of like an Uber driver. When you want a shift, you say, I'm available, and you're on shift, and people can contact you. Whereas the W-2 worker is scheduled. So they look at a schedule during the week or whatnot, plug people into those places, and, they know where they're going. The 1099s are much more self-directed. And that's one of the things they like about working for a 1099 is being able to say, I want this shift or these days or whatnot. And they have a lot more flexibility, but they're required to have their own liability insurance, pay their taxes, be compliant, and I say they're responsible for that. But again, we don't know. Do you really have liability insurance when I'm hiring you as a contract person from a platform? So lots of things that we really just don't know and feel like as we go forward looking at staffing agencies, there are things worth having a conversation about and seeing if we can't find better ways to do that. For the rest of the presentation, we will have Kylie Childs, and she's going to get into some of the meat and potatoes about what other states are doing and give us some suggestions on how we might want to look at things from different perspectives. So thank you. I'll stand for questions at the appropriate time.
Committee, any questions for Linda before we transition? Representative Steens and then Representative Orr-Payzit.
Thank you, Mr. Chair. I just had a really quick question about, like, between the contract and the, say, your staff nursing is, one of the things I think that gets frustrating for some of the staff nursing and or even just staff care workers, healthcare workers, is, I understand why people work contract, right? Because they make a lot of money. More money than they're probably going to get paid in a regular setting or staff setting. And like you were talking about the training and those kinds of things, because you see sometimes that you have contract nurses that come into facilities that maybe don't have that type of training in that particular area, perhaps like in the like just say a labor delivery nurse or, versus maybe going into like a senior living, like assisted living or something like that. What do you think, and maybe this is a broader question, but because they're not, and I don't mean this as a general overstatement, but I don't know that they're as invested sometimes, right? Because you have those people that know who the patients are, especially in like maybe a longer term care setting or something like that. But how do we, maybe as a whole, somehow try to bridge that where we're getting more qualified people, or, maybe that's a workforce question, but as far as like making it better for the people that work in these facilities, right? The nurses and other care staff, whether it's a CNA, the nurse, the therapist, whoever, and then try to provide that education too to those people. Because a lot of times they just come into the facilities and, they're just like, here you go, here's your patient load, see you later.
Yeah, work your shift and
yeah,
get on out. Mr. Chair, if I might answer. You're absolutely right. The people that are on staff at the nursing home, the majority of them are there because that's where their heart is, that's where their passion is. They have found the place where they can make a difference, whether it's as a nurse aide or in the laundry and they get that smile from Mrs. Jones when they come back into the room. They're there for a reason. And studies have shown that consistent staffing brings resident satisfaction, and it improves care. If you know the person and what their normal day is like and what their patterns are, you can spot when things aren't quite right, So using staffing agency, in the best possible world, we'd have enough people to work, and we'd never have to use agency. Even in the better possible world, we would not have to borrow from one unit to another for shift, that you'd have your same people day after day to get that bond and get that care that they need. That's not the world we live in. So with staffing agencies, you know, when they come into our building, it's up to the current staff to show them where the shower rooms are, show them where the towels are, show them where the dirty linen is. So there is a burden and responsibility on the full-time staff there. And sometimes there can be a rub. But one of the things that Kylie's going to talk to you about too is the non-compete clauses. Some people come into our facilities and they fall in love with it. And they're like, man, I want to work here. You're 2 blocks from my house. You know, I know these people, they're part of my community, and they can't get out of their contract, or the home has to pay $10,000 to get them out. So there's some barriers there that I think we can knock down pretty easily.
Representative Orpeza.
Thank you, Mr. Chair. So my question is are you, when you stated that sometimes you have contract nurses or people who come in who you don't know if they have the health insurance, and at some point you're not able to find them if something unfortunate happens or a complication, does the nursing homes not do any type of vetting with these agencies that they use?
That's the question is very valid. The contract is with the staffing agency and the nursing home. The onus is supposed to be on the staffing agency to verify those individuals and to hold their licensure and do their background checks. What we're finding, though, is that it's sometimes very difficult when we need to reach back out to that agency and find a particular person, that they have left that agency, they've gone on down the road, and we don't have any way of reaching them.
Okay, thank you. Mr. Chair, do you mind if I ask the previous conferee same question of their,
Can we call you back up the stand? Not the stand.
yeah.
It's been a long day. I apologize.
That's a different experience.
Yeah, so the question was, so we know the facilities that you're involved in and using of agency. Do you have problems following up with agencies and having these disappearing contract people and not able to vet, or?
Our contract requires any nurse or any employee that we bring in to show us their license or their registration. And then if we release somebody for any reason or for cause, we let the agency know, but we act on that. So I don't know that we have a problem finding people if we have had some instances where we've got a risk management report of an action, and as we investigated, it's somebody who was a witness or was part of the incident. It's an agency nurse that no longer works for us. We can go back to the agency and try to track down from there, but really it's the responsibility's on us for the care that we provide at the time we provide it.
Okay, thank you. Thank you, Mr. Chair.
Representative Ballard and then Representative King.
Stay close. Mine's with you, Scott.
Now, this is an interesting one. When you say agency, is a hospital an agency?
No.
You know, I've never thought about that, but when you look at it, you say your nurses are employees of an agency, receive a W-2, and then you look at it and responsible for withholding, paying payroll, and handle scheduling and credentialing and all of that. A hospital does all of that. What is the distinction then? Since the hospital does, because they're larger, but then you have smaller hospitals or supplement hospitals. So what's
And if I might, the agency, the hospital, or the nursing home. And it's that the nursing home and the hospital are the employers, and we are responsible for the residents in the care. So a hospital is responsible for those folks that are in there in the emergency room and for surgery. An agency has no one that they're directly responsible for. They have their employees, and they send their employees out to work in another licensed location where they don't have their own license themselves.
Okay, then we have Representative King, and are you for Linda or for Scott?
Thank you, Mr. Chair, Deputy Secretary. Hey, just a quick question for you. Do you have an online portal where people can fill out this information and data so you would have it and you could follow that person, didn't matter where they were working at or where they were tracking at?
For the supplemental staffing agencies themselves, no.
All right, thank you, Mr. Chair.
All right, thank you. Okay, are we transitioning now to Kylie? I think we're trying to. All right. Next up, we have Kylie Childs, Leading Age Kansas. Welcome, Kylie.
All right. Thank you, everybody. Kylie Childs, Director of Government Affairs with Leading Age Kansas. I know I'm the last thing standing between you and some sunshine and fresh air, so I will try and keep this short. So to answer Representative Oropeza's question from earlier, there are at least 23 other states who have codified staffing agency standards into their statutes, as well as the District of Columbia. So there's 24 total. And most of these states at a minimum are granting oversight authority and registration for or licensing requirements to certain state agencies that allow that agency to adopt necessary rules and regulations if needed. In addition to some of the more basic statutes, some states have also gone one step further past that, outlining requirements that are related to some of the things Linda talked about, with completing background checks, verifying licenses of personnel, requiring insurance coverage for accidents, and more. So as you can see on the map, there are a wide variety of states who have taken action, but only 2 states have utilized the correct language to add oversight to those 1099 tech platform companies, and both of those happen to be on either side of Kansas. So that would be Colorado and Missouri. And as Linda mentioned in the slide before, there are differences between these two entities, with 1099 tech platform companies bringing individuals in on that contractual basis. So to avoid misclassification issues, we would also have to look at what does that language have to be, so we're not using the term employee when it comes to oversight and regulation for a tech platform company. It's an independent contractor. So those are some of the things that we'd have to look at if you're looking to craft some legislation that would help with addressing this issue. One thing I will add on that slide down at the bottom, each of the states that are highlighted, there are links that should take you to the direct statute and regulations that gives you some more information about what they do require specifically. All right, so now we get to jump into the fun things. I will add a little caveat that anything related to insurance, fidelity bonds, and workers' comp that we're going to talk about, I did bring my resident expert from Leading Age Kansas, Kevin McFarland. So I can answer some high-level things, but if we start getting into the weeds, I may bring him up to help with answering those questions. So why is insurance coverage important for staffing agencies and 1099 tech platform companies? Simply put, it ensures protections for both the agency company as well as the healthcare facility and any residents that are being served. So it's important to note that different insurance coverage policies do different things. General liability insurance protects agencies from non-medical claims that could arise from business operations, but it does not cover errors in medical care provided by contract nurses. Professional liability insurance tends to cover agency-level mistakes related to staffing, credentialing, and placements, but it does not go as far as malpractice insurance in covering medical errors or harm caused by a contract nurse during patient care. So we have heard from members exact examples that are on the slide where agencies have sent unqualified personnel or contract personnel that go against what the healthcare facility's policies and procedures are, and it has resulted in direct patient harm. So since there's not a requirement to carry this type of coverage, it is often something that agencies do not do, and we will see penalties come back to the healthcare facility through an insurance claim or complaint survey through KDADS. So from our understanding, general liability insurance is not a requirement for staffing agencies through the Kansas Department of Labor standards, but is generally recommended. So you might see some of them doing it, and a lot of those who are Joint Commission certified will often do that to meet those standards, and that's kind of the standard that we're wanting to see across all of them that are operating in the state. In addition to insurance, fidelity or dishonesty bonds are a good step in ensuring best practices and further safety coverage for all parties involved. Fidelity bonds help build trust with healthcare facilities by ensuring protection against financial misconduct by agency nurses or staff. However, this type of bond typically only extends coverage for a W-2 employee, which would come into direct contradiction with our 1099 tech platform companies. So a dishonesty bond protects against nurses or administrative staff stealing from healthcare facilities or patients. So this type of bond typically applies to your W-2 employees, but some policies can cover those 1099 contractors if structured properly to avoid misclassification. So from our understanding, healthcare providers are required to carry surety bonds, often fidelity, and some healthcare staffing agencies may be required to obtain one depending on their business operations and how they're billing according to the Kansas Department of Labor. So if they are billing or doing anything related to Medicare and Medicaid, that is often when these surety bonds will become a requirement through current standards that we have in the state. Workers' compensation insurance is required by law in most states for W-2 employees, and we believe the Kansas Department of Labor standards would apply to W-2 staffing agencies today. This type of insurance protects the agency from liability claims related to workplace injuries and covers injuries occurring on assignment at healthcare facilities. So when there is not adequate coverage, the claim can come back against the healthcare facility provider despite the individual not being an employee of that facility. Occupational accident insurance is designed for independent contractors or 1099 nurses who are not eligible for workers' compensation. It's not typically legally required and less comprehensive than workers' compensation coverage, but it may be used as an alternative in some situations to prevent misclassification of workers. So when we're talking about those 1099 tech platform companies, there are different ones that will continue to offer workers' compensation, and it's something that they will offer to allow those nurses to buy out through their company. And there's other ones that choose to go down the route of occupational accident insurance. For non-competes, they are typically worked into contracts between agencies and healthcare facilities to prevent nurses from working directly for a healthcare facility or a competing agency for a certain period of time after leaving the staffing agency. Liquidated damages can be related to the same situation by requiring a preset financial penalty the nurse or healthcare facility must pay if they violate the contract by attempting to end it early. So both of these items are ways for staffing agencies to protect their investment in their staff and prevent them from losing staff to the facilities they send them to. However, we do have staffing agencies that may have staff come into our healthcare facilities, talk to others about their opportunities, and shift them away from working in our healthcare facilities. So there have been times a full-time employee for a healthcare facility quits, returns the next day working for the contract agency at a higher pay and cost to the healthcare facility. Many states, including Missouri, have included language in their statutes to address these two contractual aspects by banning them due to the high demand and need for nurses and the result of increased costs for healthcare facilities, which trickles over to their Medicaid costs, paid for with state and federal taxpayer dollars. So we believe by following Missouri's lead and removing these, we can create a truly level playing field between agencies and healthcare facilities and facilitating that freedom of employment that our nurses are wanting to see throughout the state. So Leading Age Kansas, along with the Kansas Healthcare Association and other health care associations, have been discussing staffing agency standards for at least the past 5 years, and especially at the height of the pandemic when costs tripled and staffing demands were at all-time highs. Part of the concern from various parties involved in these conversations have been that there is a free market argument and how adding standards goes against that widely held value in Kansas. So we believe we can still operate in a free market environment by adding these standards in, as the non-competes and liquidated damages restrict market movement and can artificially limit competition by preventing nurses and long-term care providers from freely negotiating employment terms. Instead of forcing retention through legal contracts, we believe that agencies and long-term care providers should compete on wages, benefits, working conditions, and ensuring the most efficient, worker-friendly organizations succeed. Additionally, adding standards will, for staffing agencies, will prevent them from controlling the market and directly impact Medicaid costs related to staffing for healthcare facilities. And I know that's been a big conversation for the state legislature, especially as it relates to our state hospitals over the last couple years as well. As you heard from KDADS earlier, Kansas currently utilizes proviso language in the budget to try to gain an understanding of who is operating in the state. However, there is really no teeth to this language. If there is a complaint about how a staffing agency is operating, KDADS does not currently hold that authority to do anything with investigating, issuing fines or penalties or anything about it. Additionally, while the intent is for agencies to register and provide quarterly reporting, there's no penalty if they do not do so. So we are hoping agencies are choosing to operate in alignment with the will of the legislative body, but there's not much that can be done with any bad actors that are operating in the state. And that's typically what we see for any kind of standards related to healthcare facilities or anything related to healthcare. Those standards try and set the standard to weed out some of those bad actors that we may see in the state. So healthcare staffing agencies are a critical need in our state. There will always be times a healthcare facility will need to work with a staffing agency or tech platform company to cover shifts as illnesses or other situations happen that prevent full staffing from taking place 24/7, 365. What we'd like to see in Kansas has also been done in other states, including Missouri, as standards that align with basic standards of care and ensuring protections for those being served while also providing transparency to taxpayers who ultimately are footing the bill for staffing costs as they relate to Medicaid. So we're eager to keep working with you all, identifying what other states are doing and continuing to talk about what we can do to take steps to protect and enhance our workforce as it relates to healthcare. So thank you for the opportunity and giving us the chance to come late in the afternoon. So Linda and I or others may be available for questions if you have any.
Okay, Kylie, thank you. Committee, any questions for Kylie? Representative Steens.
Thank you, Mr. Chair. I just have more of a comment. I mean, I think this is very needed. Honestly, I worked with nurses and they'll say, oh, like you said, I think our previous conferee said the same thing, that they really like a facility and they would like to stay there, but they have to pay these exuberant fines to get out of that contract, or there's no compete clauses that they have. And that just doesn't make sense, right? So especially if someone's kind of new and they're looking at maybe different facilities or maybe different kinds of care that they want to do and they're not sure what setting they want to work in. But I also agree with, if you have someone who comes into your facility, right, and they aren't the right fit, and let's just say they do, and we all know that's happened, and not just in nursing care homes or in independent or assisted livings, but also in hospitals as well. So we do need to set some sort of standards. Are they not required then, like, if you're an individual, like 1099, to carry their own malpractice? Did I read that incorrectly, or?
Based on what we read through the Department of Labor standards, we did not find anything that they would have to carry anything unless they are billing directly for Medicaid or Medicare.
Okay. So if they come in to a facility, or we don't know if they have their own malpractice or not, and that would fall on that facility then?
Correct.
Or hospital or whoever they're coming into.
Most of the time, we're trying to ask for those certain things to be presented to us. We have had situations, especially during the height of the pandemic, there were a lot of agencies that would pop up overnight and then they would be gone the next day. They would show proof of liability insurance of some type and then cancel the policy. So then we would have issues arise and it would fall back to the healthcare provider to cover that.
Thank you for that presentation. I agree with you. It's very much needed.
Thank you.
Okay, Kylie, I have a question. So in reference to the Missouri and Colorado laws, do you know when they went into effect?
I will have to double check on Colorado. Missouri was in 2023.
I don't know if you know enough about, or the differences between the two laws. I don't know if it was you or Linda, somebody mentioned differences between the two states. And I'm not asking you to be an expert, but would you have a preference? You know, if Kansas was going to look at something first, would it be Colorado? Would it be the state of Missouri? Do you know?
I think Missouri typically aligns with Kansas a little bit better in how we practice, our market value. So I think looking at that language, it's been looked at more recently too by the tech platform companies and the staffing agencies of definitions and making sure we're truly capturing that market. So I think if we're going to look at anything, Missouri would be the most up to date.
I appreciate that, and I will admit to thinking at this through the lens of someone who has family members who have been in or are in assisted living centers, and I hear my family members talk about, oh, their agency or their whatever. I mean, the residents know the difference between the types of caregivers that are in those facilities, and that's not necessarily a negative, but they tend to feel like they get a lesser degree of care from an agency person, someone who's there today and may not be there 5 minutes from now. So I appreciate the presentation. Committee, any other questions? Representative Carpenter and then Representative Ballard.
Thank you for that, and I appreciate the dialogue, and, you know, you guys kind of know where I'm at on this contract nursing. I think, and I agree that there are some things that we can do, but I do think that the thing that we have to continue to remember and why we didn't do a lot in the past, and especially during COVID, was that these nurses are mobile. And if you run them out of Kansas, you're just going to run them someplace else where they can make the money. And I'm not against trying to look at a level playing field whatsoever, but I know we looked at it back in COVID, and the states, there was like 6 states that had passed laws, Minnesota being one of them. Well, they actually, you know, lost nurses because people said, well, if I can go over, and it was a little bit more fluid in those days because, you know, everyone was looking for nurses. But if you can make $50 an hour and go some other state, and you're traveling anyway, I'm just saying, it's not the end all be all, but I do think it needs to be a level playing field, and they need to provide all the stuff that a regular, you know, that we provide, and make sure that they do. So, thank you.
Representative Ballard?
Yes. Talking about free market arguments, it's on. I have to kind of yell, right? But I'm just looking at it. Would you say that contract nursing would do better if they were under the free market non-compete clause? Or are they exempt?
Are you asking if they would do better if we went away with non-competes or keeping them?
Do away with.
I think there's pros and cons to either one. I think there's a chance that they could have more flexibility with having people come back and forth. I think there's also ways for them to still protect their investment, just as there would be for us in designing those contracts to make sure that, okay, if we're going to operate on free market with no non-competes, then it's going to be dual language that we're not going to actively recruit from each other. So there's some things that could still be worked into contracts to protect that investment, but still allow for people to make the decision of what works best for them and their family of where they want to work.
But when a person signs up, they know from the beginning that there's a non-compete clause. Am I correct?
Correct.
You do. So that if they know that, and then they're there, and then someone said, well, it's unfair. But if I know what my expectations are and what my limits are, and I'm doing this and I know, then it seems to me I don't have an argument to be complaining about it when I knew what I was getting into. Now, doctors have non-compete clauses too. And I think the ones we have sometimes is within 50-mile radius or whatever you have. So they're bound by that. So if an agency is placing someone and they have to worry all the time about whether or not they're going to lose somebody when they place them there, then that doesn't seem to be fair.
I think then we have to look at what is that language to protect both sides so that there can be a level playing field, so that we're not protecting just one side of a staffing agency saying, no, there's a non-compete, you cannot recruit our staff away, but they're not able to come into our healthcare facilities and also recruit our staff away as well.
Thank you.
Representative Rivas.
I'm not an attorney, but I have dealt with non-compete clauses a little bit, so I just know that, yeah, there's a lot about equity on both sides of the equation, or they're not valid. So I would just speak to the one underlying thing here, and that we're really talking about as much as the quality and the consistency of care, because my daughter's been a nurse in these places where there have been agency nurses. I've been to the nursing homes where there have been agency nurses. Some of them are fantastic, but it's hard for the residents, especially long-term care or assisted living. They develop relationships. I mean, and that nurse, they kind of get the vibe on that patient day to day, and they detect things or behaviors. And so they really are a big adjunct to the medical community when the doctors come around to do rounds. So there's a lot more to this than just agencies good or bad. So I think in the spirit of what's best for patients, I would love to see us do something. But my ask is, what is the ask for next year exactly? Because there's a lot of data here, a lot of asks. So is this one thing where we try to get one or two things in next session? Maybe there's something else the next year? I mean, or is it one big package? We're going to fix it at once?
Yeah, so as they shared earlier with the ks.gov presentation, there are two bills that are setting up here in session that were introduced this year. And so HB 2184, I believe, is still sitting in this committee. And that would be one large package that tries to go through and address each of these components. And so that would be the request, is looking at that as an entire package.
Representative Steens.
Thank you for allowing me to readdress a little bit, Mr. Chair. The other thing I was going to say, and just a point, is a lot of these CNAs can really leave anyway, regardless of, I mean, there's jobs everywhere, right, for CNAs especially, and nurses as well. And I think sometimes, too, the unfair thing with the contract, and like I said, I love free markets as well, but then they're thinking, well, yeah, they're making $10 more an hour than I am doing the same thing, and I've got to train that person. So I'm not just having to do my job, then I'm also having to orient the agency person and make sure they have this and make sure they have that. And so I do think that there's a lot more that goes into that than people recognize or realize, right? So there's a need for contract on one end. Don't get me wrong. I'm not saying that there still is not a market for that, but I do think there has to be some sort of standardized care that we have to have for everyone, regardless. Just because you're a contract agency doesn't mean that you should not have to have those same standards. So thank you.
Okay, committee, any other questions? Representative Ballard?
Except this has been very interesting. I mean, I've been on this committee for a long time, and it's the first time we kind of get into what I would call the nitty-gritty stuff. We start talking about the help they need and the counseling and the help, but to really look at all these other little things that have to work too, because agencies have to work, hospitals have to work, and all of that is sort of like, it was kind of refreshing to look at that, and I was going, ooh, I didn't know that. I didn't know that, so thank you very, very much.
Thank you.
Well, Conferees, thank you for bringing that today. Again, just the reminder for the 18th, if Francie doesn't have your information, we'll get it out to you. For those of you who attended today, appreciate this, and as Representative Ballard mentioned, this was kind of an attempt, today and yesterday was to help this committee get beyond just hearing budget stuff and figure out where can we partner and work together and work on things. So thank you for being here, and with that, we're adjourned. Thank you so much.